Veterans who receive health care through the Veterans Administration can now go to the Kern Valley Hospital for their primary care. In Mount Mesa, I'm Corey O'Leary, your neighborhood reporter, and it took years of advocacy from locals to make this dream a reality. Whenever Evans isn't working for his tree business, he's getting involved in local veteran affairs. Whether that's cooking breakfast for veterans at the VFW or running meetings as the commander of the American Legion Post 711.
They need the representation. You know, they're the ones that are making that sacrifice on the front end. You know, and they're not being taken care of on the back end.
That's why roughly 3 years ago, local advocate Gary Zuber and a representative from Kevin McCarthy's office got together with him and asked him what veterans in the Valley needed most. Something he brought up was access to health care.
A lot of the veterans in this valley, especially in this valley, are older veterans. And these are elderly veterans with PTSD. So now you're expecting them to drive 120 miles for blood work.
Those who receive their health care through the VA have to do so either at the clinic in Bakersfield or the one in Los Angeles, which includes a long twisty drive down the Kern River Canyon.
Me having to drive my brother-in-law to UCLA the other day, I was stressed out with the drive.
However, the Kern Valley Healthcare District recently signed a contract with TRICARE Health, making it so they can provide their services to local veterans.
Comparable probably to a managed care contract that we would have with Blue Cross. It's basically an agreement that allows us to use our providers to care for their members in our community.
Tim McGlew, CEO of the Kern Valley Hospital, says the new contract is unique for the VA. In the past, they usually required care at their clinics.
Talking with the veterans up here, you know, the problem was that they were just not going because it was too much of a hassle. And so until something happened and they developed cancer or something like this where they had to deal with it, but it was a much more serious problem than if they had been able to take care of it routinely.
But since the contract was signed in December,
we're now beginning to see more of them show up.
It wasn't easy.
It's been a long process. 3 years it took.
McGlew said himself and Gary Zuber negotiated with the VA.
The communication efforts we've had over the last several years has been the VA wanting to bring a team of their people up here once or twice a month. Our argument with that has been, well, care is an ongoing issue. You can't be once or twice a month, you know, people need care now.
The VA eventually agreed, and this new arrangement could be seen as a model that works for other rural communities.
This step over here at the hospital is super cool. Yeah, it's a blessing.
Evan tells me this illustrates what locals can achieve when they work hard to better their community. In Mount Mesa, I'm Corey O'Leary, your neighborhood reporter.